I am now pleased to present the award for Outstanding Member of the United States Senate. This year's winner is Roy Blunt, U.S. Senator for the state of Missouri. Prior to being elected to the Senate in 2010, Mr. Blunt served as member of the House of Representatives for the 7th District of Missouri for 14 years. Throughout his career as a legislator, Senator Blunt has developed a reputation for working on a bipartisan basis to enact important healthcare legislation and to provide federal funding for health priorities and facilities. Among his many accomplishments, working with Senator Debbie Stabenow of Michigan to expand community mental health and substance use services through the Excellence in Mental Health and Addiction Treatment Act, which became law in 2014. Using his leadership position on the Senate Appropriations Subcommittee to win increased investments in biomedical research and significantly higher funding for the National Institutes of Health. And advocating for expanded telehealth services through and beyond the pandemic, including co-sponsorship of the AMA-supported Connect for Health Act. Closer to home, Senator Blunt was instrumental in securing funding for the Next Gen Precision Medicine Institute, named for him at the University of Missouri-Columbia campus. He also championed the expansion of the University of Missouri-Kansas City School of Medicine to an additional campus in rural St. Joseph, Missouri, which expands graduate medical education for students who will practice in states with primary care provider shortages. In nominating Senator Blunt for this award, Dr. Mary Jackson, Dean of the UMKC School of Medicine, credits him for his extraordinary leadership and unwavering commitment to improving rural health care, for making a major impact on the health of underserved citizens of Missouri. Senator, for your leadership on healthcare priorities that will benefit the people of Missouri and the entire country, the AMA is pleased to present you with our award for outstanding government service. Thank you.
Hi, I'm Senator Roy Blunt. I want to thank the American Medical Association for selecting me for the Outstanding Government Service Award. I'm also truly honored to have received this nomination from Dean Mary Ann Jackson at the University of Missouri, Kansas City Medical School. I want to thank her for the tremendous work she's done at UMKC, and especially for the medical school's campus expansion to St. Joseph, Missouri. What that really does is respond to our new emphasis on preparing doctors in smaller cities and near rural areas where we think they'll be more likely to serve if they've had a chance to train in that environment and find out the satisfaction that can come there. As the former chairman of the Labor, Health, and Human Services and Education Subcommittee, and now the top Republican on an evenly divided committee, I've spent the last 7 years focused on prioritizing investment in our medical research infrastructure, expanding access to mental health, and investing in the health workforce, as well as strengthening medical education programs. Over the past 6 years, we've been able to increase funding for the National Institutes of Health by almost $13 billion. That's a nearly 43% increase for NIH, and it's fundamentally changed the trajectory of biomedical research funding in this country, and it's also kept a lot of young researchers who were dramatically discouraged by a decade of no increase in the research field. We've increased NIH grant success rate, we've increased their buying power, and forever, I think, changed the prospects of scientists looking to cure our deadly diseases in different ways that are much more focused, much more personalized, much more based on looking at what you can find in that individual to help fight back. I've also been focused on restructuring programs to treat mental health like all other health. I'm proud to have worked with Senator Debbie Stabenow from Michigan to create the Excellence in Mental Health program, now totally in 10 states and partially in 41 states, where mental health for government payers, particularly Medicaid, is handled just like any other health. And I think what we're seeing there is within the immediate healthcare space, you save money if people are taking their medicine, going to their appointments, eating better, sleeping better, feeling better about themselves. Their other healthcare costs are more easily dealt with in a way that more than offsets what we've always known was the right thing to do. I think this bill, frankly, may be the biggest step forward in expanding community mental health and addiction services in decades. by really creating certified community behavioral health clinics in all of those states. We're hoping to expand that effort one more time in this Congress. Finally, if there's one lesson reinforced by the pandemic, it's the importance of medical professionals. We need to ensure that you have and they have the tools needed to do the job, but also support that you need to enlist at the earliest stages of educational opportunity people in healthcare training in the healthcare field. Over the past 6 years, we've increased Pell Grant funding to a high of $6,495. We've had an increase in that funding every year. We've restored year-round Pell and strengthened programs that support health professionals. We've also created a new student medical education program to focus specifically on states that have a physician shortage or will have one by 2025. Thanks especially to America's doctors, and thanks again for this recognition.